Pelosi? Yeah, she really does. And it's frustrating because she does make some really silly comments. She made this comment. You've heard this one, I think, already. I hope you have. This is the one where last night I asked Pete Sepp, does she have any friends? No, you asked her if she needed a tuna sandwich because her melon wasn't really working. Oh, yeah. But I wondered out loud, does she have any friends? Because why would a friend say this in light of what Obamacare is? I believe it's cut number 12 or 15, one of the two. Whatever's down there, roll it.
One evidence of governance would be how we rolled out the Affordable Care Act. It is intact. It's beautiful. As with everything, it's a work in progress. We need to improve it. But the website didn't work, and now it's well. Mm-hmm. And we go forward.
It's beautiful. Now, this is a strategy. There's some strategery here. Did you really figure that one out on your own, Einstein? They're saying something that's completely ridiculous, saying it over and over again, thinking you'll believe it. Like the economy's recovering. Remember in Recovery Summer 2010? How about with Benghazi? Remember, what was that? Blame it on a YouTube video. No, we didn't lie. Here's the proof that you lied. We still didn't lie. No, it's not traced to the White House. Oh, here's the communication. Well, we released 25,000 pages of documents. No, really. We've been forthcoming, 25,000 pages of documents. But what about the one from Judicial Watch that you had to get through a court order, Freedom of Information Act? What about that? Oh, well, you're racist. Or now it's going to be Trey Gowdy hates grandmothers. How'd you come up with that one, Crane? Because Hillary Clinton's a grandmother, and she will say, hey, we've had this accountability review board, and the recommendations were following, but they didn't interview you. You selected them, and they didn't put you under oath. Why would I have anything there in light of the fact that you haven't been honest from the start? And Gregory Hicks, second man on the ground in Benghazi, said there's no way you can know about these requests for more security. I don't know. I do know. Repeating, saying it's beautiful as you have 73% of the people who signed up on the exchanges, they didn't have health insurance before. It's victory, Crane. 73%. How do you like that? Wrong answer. 73% previously were insured. What about the premiums going down? Wrong answer. Please stop using that. I'd maybe use something like think Gene Rayburn and the little buzzers when they got it wrong. Oh yeah, that was yeah, you remember that one? That was from Pyramid, where they got it. You heard that little sound? We'll have some more sound effects. I'm working on it. Are you going to do them? No. Hey, we got sound. We got producers. We take care of that stuff. Here's the point that I'm getting to. They're telling you something that's not true over and over again, hoping just somehow that either you won't believe your own experience, or if you are one of the people, percentage-wise much lower, that has benefited in the near term, well, you'll believe that is true for everybody. They're counting on you, forgetting the deception, forgetting the fact that this has been very destructive to the economy. They don't want you to connect the dots, put things in order. No, they don't want that. They don't want you to realize, well, wait a second, when a business's costs are raised, is it going to be able to hire more people? Wait, their costs go up. Costs, okay, so they're paying more per employee. Would that allow them to hire more people? Would that actually allow for more growth? They want you to forget the horror stories that we've detailed, including our very own Jim Hoft. In the sense of very own, good friend of the show, Gateway Pundit and Progressives Today. They want to forget that. Or your experience that you all have been writing me about, are our premiums that go up when they were promised to go down. $2,500 on average, yeah. They want you to forget the president lied and then tried to say that he did not lie. even despite all the information. How could they do this? Well, that's why the mainstream media is such a problem, because they don't tell you the truth. Well, Captain Obvious, I've missed you. So if you know that and you get that, what are they doing now? What is this Nancy Pelosi bizarre, beautiful, oh, it's working out, the computer problems are fixed? Actually, they're not. Congressional hearing less than a month ago said they were not fixed. So wait a second. How is that? If the law is so good, and this is why I just know you're the smartest audience in talk radio, talk television, period. Because you all reference this stuff every time I post something on Obamacare and I put up Nancy Pelosi making ridiculous comments. And what's a shame about this is we have the likes of our good friend Dr. Paul Howard from the Manhattan Institute, PhD, to explain this to us, to give us the truth. Because, hey, you might think he's a right-wing Christian, far-right guy. Yeah, he wants to take our rights. He doesn't really want a conversation. No, he actually just believes in the rule of law. And if you look at policy, social or otherwise, that goes back to the states, and then we have the debate. See, I believe in that. I believe in that. Because substance will win in people's own experience closer to the government they are. That's why the federal government's limited. Stop it, Crane. We've got Dr. Paul Howard now. Right now? Oh, yeah. Dr. Paul Howard, welcome back. How are you, my friend?
My pleasure to be on the show again. Thank you very much.
Great to be with you. Thank you for making time, as always. Let's get right to it. I just talked about Nancy Pelosi needing a tuna sandwich because of the fact that the statements she's making really are not making sense. And sometimes you need a Snickers or a tuna sandwich, whatever. Point is, you need something to get the melon to work a little better. Maybe you're dehydrated. Or maybe you need a good friend to tell you that what you're saying is ridiculous. But in the area of politics, this is what's said because they want us to believe it, and they feel they can repeat it over and over again and say something's true. Well, something that is true is that she desired a single-payer system. Here's part 2 of the comment that we played for you all last night, or another comment from that same interview with Ezra Klein. Roll it.
I think the Democrats will run on saying that the Affordable Care Act is really important for America's families, and that we stand ready to improve it as we see how it is implemented. I think that's a really important message, not to let it be repeal or retain, but to have the Affordable Care Act and improve upon it. I have some of my own suggestions that I couldn't get through on the first round, so I like that message.
How would you like to see it improved?
Well, of course, I wanted a single payer and I wanted a public option, but that not being in the mix, you have to prioritize what it is you want to get over the finish line. And now let's refine and improve, and some of that relates to how it is implemented, so you see how it is implemented.
All right, so Dr. Paul Howard, let me ask you this. If we were to have a single-payer system, would it be the closest thing I think that mirrors it today would be either the VA or Medicaid as we know it? How are those programs, or those two programs, taking care of those that are in need?
Not very well. And I think that one important point that can be raised here is, look, a single-payer system where the government's the insurer is one thing. Clearly, that's not where we want to go. But at the same time, this is a step further. The VA is not just a single payer. The VA, Medicare is a single payer, but effectively. But in the VA, the government actually owns and operates and pays the doctors in these hospitals. So it is literally socialized medicine, where the government controls the entire healthcare system directly. And that's where you see these problems with wait lists, with bonuses that are paid to performance, that are manipulated by these employees of VA clinics that we're hearing about. Those are classic problems of socialized medicine, and we're just seeing them play out in real time.
So if we're seeing these things play out in real time, what does that mean? Well, I mean, because what I'm gathering is, if this is what they would like to see, granted the distinction, but inevitably they would like to see insurance companies go away because they've demonized them, put the costs on them, bail them out now, but who's to say what happens in the future? Your thoughts?
Right. So, you look at the systems that really are socialized medicine. It's Canada, it's the UK, and those systems have been plagued with quality problems. Patients dying neglected in hospitals because they're not receiving proper treatment. Higher than average infection rates, delayed access. Things like Canada to scan to detect and treat cancer. Those are the problems you see when there's no exit mechanism. So right now, at least, in the private healthcare system, even under Obamacare, if you don't like the health insurance you've got, you don't like the care you're getting at one hospital, you can go to a different hospital. And to some extent, veterans can go to private hospitals. But when the government itself is controlling the hospitals, controlling the payments to physicians, then you really get into problems with capitated budgets, poor access to care, and these long wait times that we're seeing where veterans may have literally died waiting for care. That's the chief problem you're seeing in the VA. Medicaid has its own problems. It pays too little to get private physicians to accept them. Medicare's finances are a wreck, but at least most physicians and hospitals accept it, and you can choose among competing private hospitals. In the VA, if you can't go out of that system, if you don't have alternative private coverage, you're stuck with that system and stuck with the poor quality of care you're getting.
What about the people that can't afford their premiums under the new system? Is there alternative to that Medicaid?
Right. Potentially, if they are so poor they qualify for Medicaid, that's an alternative for them. But again, Medicaid pays physicians so little that they would have potentially problems getting access to the private physicians to see them and treat them. One of the issues that's been brought up, I believe Senator McCain and Senators Coburn and Burr are talking about creating a voucher system modeled after something like the Federal Employees Health Benefit Program, where veterans could then take vouchers and go to purchase private insurance and go right to private hospitals to get care.
Right.
That's got to be one element of the solution. There's no reason why the federal government has to offer an entire network of hospital systems to care specifically for veterans. You can outsource all of that to the private system. Maybe you need to make allowances for some of the most heavily disabled veterans that need special care for traumatic brain injuries. But again, we've got experts at private hospitals that can do that as well. I think it's really just a matter of opening up the system to competition and giving our veterans a real choice.
So you've just detailed the difference between single payer and totally run government healthcare, which is the VA. You've talked about the solutions for the VA and you've introduced competition. We've talked about Medicaid, too, and in reference to that, because I see an Obamacare sell that's false here. You can correct me if I'm wrong, but calling it beautiful, to me, is spin and baloney, or as my daughter would like to say, bunny stew. The point is this. When we have Obamacare and people are evaluating the Affordable Care Act from our president, Obamacare, otherwise known as, you've done extensive work on Medicaid. And if those people are priced out and they've lowered the qualifications and the standards for qualifying for Medicaid, I mean, some of the stories you've even covered, if I'm not mistaken, because of background, Paul, you are the man when it comes to covering Medicaid. I believe you wrote the book on it or were a part of the research. So tell me, Medicaid, you've just said doctors aren't taking it, not paying it, but is this the future that they think is successful? Because why would they expand a program that is broken? Go ahead.
I think there's a lot of hypocrisy on the left about Medicaid, because obviously if you think it's a good program, you'd say, well, let's move more Americans into that. Let's move Congress members and staff into that program. Obviously, nobody wants to do that. It's really a third-class healthcare system for the poor, and that's a tremendous problem. And it's hypocrisy, for defenders of government-run healthcare facilities to say, oh, that's a good option for people. So that is a real problem. Similarly with the VA system, runs into problems a lot of what we've just spoken about. The idea is basically you want competition. You can have competition between private schools and public schools. You can have competition between private universities and public universities. It's really that element of choice in being able to leave a system and go to a superior provider that provides some discipline. You had some improvement in the VA system during the 1990s when it was led by a more competent administrator, but as soon as that administrator left, the system falls into disarray again. So that's really one of the chief problems here. In the absence of competition, you generally get poor performance. Like in a city, for instance, you can have a competent city manager come, but if that competence leaves, then quality declines. But people can at least leave and seek different environments and elect different representatives to serve them. And the VA system, run by bureaucrats, controlled by bureaucrats, who control how they report even their own performance, these problems can be swept under the rug for quite some time.
So it is the theme I'm gathering, be it Obamacare, VA, the difference is there's one thing that would make it better: competition, freedom for the individual, the patient, to use the resources that they have or are subsidized for them to choose, and not to put a stamp per se on all of them, mandating particular things in all.
Yeah, absolutely. Get more choice, more competition. One of the ironies of Obamacare, at least, is it actually allows on exchanges, health savings accounts, high deductible plans, but it has limited the choice of Americans in terms of what kind of insurance they can buy, the designs, the deductibles, what benefits they really want. I think getting more competition just in terms of choice would improve the system as well, help to bring down costs. Medicaid as a problem has not been tackled at all by the Obama administration. It's just been expanded. There has to be a real attempt.
Why aren't they listening to you, Paul? Paul, why don't you have the ear of both Democrats and Republicans? Because your background, your research, you can't really throw a new one at you and say, no, it's not solid. You have the history, you have the facts. What's going on? Final question.
Well, look, Democrats really, the preferred solution is a single-payer solution. So, with the exception of a few people like Ron Wyden and others, you don't really have thinking outside the box. And to be frank, the Republicans have just not paid that much attention to health care as one of the main, bread and butter policy issues. It's taxes, it's military.
Gotcha.
I think really for the first time now we're having Republicans pay attention, think seriously about the problem, because Obamacare is confronting them with a challenge that they just haven't faced before.
Paul, thank you for making time. I hope they listen to you. Thanks, man. Great to be with you. Crane Durham's Nothing But Truth, AFR Talk.